Hi there. My name is Daniel Lopez, and I'm a nurse with more than 15 years of experience. I'm also a lean healthcare expert, giving private health consultations using my years of experience in healthcare. We work with hospitals both in Spain and internationally, improving processes through the lean methodology, taking into account the safety of patients. Our work consists of improving working processes from the point of view of adding value, eliminating practices that do not add value. This means getting rid of waste on a day-to-day basis that takes time away from the value of patient care. When we talk about this process in hospitals, it's about eliminating non-value and adding new resources. It's about investments which allow for more efficient and more dynamic workflows. Collecting, storing and using data allows us to take a more diagnostic approach to studying the processes we are looking at. This can help us discern what is important and discard what is less important, and ultimately treat the data appropriately so that we can define lean workflows. In general, this means that hospitals change from a reactive to proactive methodology, adopting preventative strategies to get ahead in the immediate future. Basically, this data allows us to define and diagnose with more certainty. At the end of the day, big data is about collecting a substantial amount of information and analysing it in a way that can make a difference. I'd like to highlight that a solid methodology is essential in order to collect the data and understand it. This must be in place before implementing changes. Being able to collect this data effectively is what really sets the stage for meaningful change. A lot of the time, managers at large companies analyse Excel documents which contain various indicators. But there is a disconnect between what the numbers say and what really happens. A good example of this is when looking at an average hospital stay. There are certain indicators in the figures, but when do they really observe what is actually happening? When do they watch videos and analyse what happens in the emergency room? What about looking at internal medicine to see why hospital stays are higher than average? You can't see all of this on an Excel document, right? On the other hand, observation and being able to see this process from a different point of view allows you to see what is real in the day-to-day life of the practitioner and the patient. You can see what can be improved in patient safety and working processes. Combining observation, video analysis and data is key to the lean philosophy. It's always better to observe the process and verify what the numerical data is saying. Video provides objectivity in this process, facts which are indisputable, and it can be analysed later. This is also essential when dealing with different services and management teams. The facts will be recorded and evidence can be presented. Therefore, what Codimg and video analysis gives you, either live or pre-recorded, is an endless amount of real data. Real objective data that can be utilised well into the future. The data can be stored, filtered and cross-referenced using the various tools that Codimg offers, such as the dashboard. And this is key, because you can, for example, monitor how a certain process has evolved over the years by recording video clips and comparing them to see how effective changes have been. These could be of different indicators such as hand hygiene or any other indicator recommended by the World Health Organization or other organizations. Without a doubt, one of the biggest support mechanisms in the diagnostic phase of consultancy is the use of video when manipulating and cross-referencing data. And Codimg has no limits. You can personalize it and use it in your own way. There are no predefined parameters or rubrics. You decide exactly what you want to study. All the data that you generate with Codimg can also be exported and passed to Power BI or other data visualization programs, allowing you to exploit the data in additional ways. We use Codimg in Lean Consultancy, and it's essential for breaking down the mental barriers that people build. When a worker sees a process which has been done incorrectly, they can revise, review and change their processes, making them much more effective. And that's what the Lean philosophy is about, objectively changing working methods to make them more impactful.